Hello and welcome to the Canadian Digestive Health Foundation's presentation of Living Positively with IBS. My name is Catherine Mulvale and I'm the Executive Director for the Foundation. Thank you very much for joining us. The Canadian Digestive Health Foundation is here to help you. We are the foundation of the Canadian Association of Gastroenterology and are supported by physicians and scientists who specialize in digestive health and disease. It is our mission to empower people like you to take control of your digestive health with confidence and optimism. Our objectives this evening are, first, to welcome you to this special presentation. We hope to provide you with practical, beneficial information that will empower you to take control of your digestive health. Next, we want to introduce you to our special guests, Sue Grant and Dr. Stephen Vanner. And finally, we're here to answer as many of your questions as possible. The Foundation would like to thank the Canadian Institutes for Health Research for partnering with us on this event. Without their support, this session would not be possible. We hope to provide each of you with valuable information that you can use in your everyday life when speaking with your health partners. We're going to start tonight's session with comments from Sue Grant. Sue is a busy mom and nurse who actively takes part in outdoor sporting events. This includes hiking, biking, and grueling Ironman competitions. She's been living with IBS for many years. We've asked Sue to share some of her personal experiences, challenges, and victories about her life living with IBS with you tonight. Welcome, Sue.
Thank you for having me. I wanted to be a part of this presentation because I've lived with IBS for a long time and realized that there is not a lot of information out there, and the doctors don't necessarily provide the information that is helpful. To live with IBS means more than just increasing a fiber intake. It's understanding your body and learning how to cope successfully with a formula that works for you. I want to say IBS is different for everyone. My symptoms are abdominal pain, bloating, constipation and/or diarrhea, and nausea. My IBS is brought on by certain foods, stress, lack of rest, changes to my routine, even something simple like a different time zone, and sometimes for no reason at all. I try not to let it affect my life. I don't stop what I need to do. I have learned to give myself options in my exercise routine, but work and family life must and do continue. I have strategies like knowing where the bathrooms are, sticking to my morning routine always, and never eating the foods that make it worse. After I did my first Ironman, my IBS was very bad, and I did have a colonoscopy. Even though I had bloating, diarrhea, and cramps, the test came back normal. I'm a nurse working in a GI unit, so I wasn't surprised. I know my IBS is real, and I know it can't be seen on a scope test. I just have to learn how to deal with it. So I changed my lifestyle. I ensure I stay rested. I avoid the foods I know that will trigger an episode. I drink lots of water and take omega-3s and always maintain my morning routine no matter how early my day starts. I exercise every day, but change it up depending on my IBS. For me, these are the things that have helped me live with IBS, but everyone is different. I would say you should talk to your doctor and make sure that your symptoms are not related to other issues. Learn what triggers your IBS and what makes it worse. Figure out the formula that works for you.
That's wonderful, Sue. Thanks so much for being so honest and proactive in sharing your experience with us. That's wonderful. So let's move on. Our expert this evening is Dr. Stephen Vanner. Dr. Vanner is a clinician scientist at Queen's University. He's a professor of medicine and physiology and director of the Gastrointestinal Diseases Unit. His clinical interest is in gastrointestinal motility disorders, including the Irritable Bowel Syndrome, and he's funded by CIHR and the Crohn's and Colitis Foundation of Canada. He's also the recipient of a CCFC Scientists Award. He serves on numerous local and national research committees and has appeared on CBC's Marketplace. Dr. Vanner is here to share his expertise and insights into IBS to help you live positively with the syndrome. So let's get started. I'll turn it over to our expert. Welcome, Dr. Vanner.
Thank you very much, Catherine, and welcome, everyone. I'd like to begin first by thanking Sue for sharing her experiences with us and providing this wonderful overview. There have been a number of exciting advances in the understanding and management of irritable bowel syndrome, and I'm really pleased to be able to share some of these with you this evening. So we set the following learning objectives for ourselves. I'd like to talk a little bit about defining the irritable bowel syndrome, also explaining what the irritable bowel syndrome is not, talking about some of the factors that affect the irritable bowel syndrome, spending a little bit of time talking about the tests and diagnosis, and then finally talking about management and living positively with the irritable bowel syndrome. So what is irritable bowel syndrome? Well, it's a very common disorder and has two key features. One is that the abdomen or the gut is hypersensitive, and secondly, that there's an altered motility, or how the contents of the bowel move through the colon and small intestine, either too fast or too slow. As I mentioned, irritable bowel syndrome is very common, and there are many people who are suffering and experiencing this disorder. And it has a tremendous impact both in our workplace, for those who attend school, and it can diminish our enjoyment in social activities. Almost 5 million Canadians are affected by the irritable bowel syndrome. That's a tremendous number of people. It affects more women than men, and it's one of the most common causes why we're unable to attend work or to be at school. So it has a tremendous impact in many cases. As Sue's already mentioned, this condition can vary from individual to individual. Abdominal pain is a feature, though, of the irritable bowel syndrome in all patients, and it's somehow related to your bowel movements. It can be associated either with constipation or with diarrhea, or in some cases, patients experience diarrhea alternating with constipation. For many patients, there are also some associated symptoms: increased abdominal gas, sensation of bloating and cramps, and many patients notice mucus in their stools. So I also want to say what the irritable bowel syndrome is not. And fortunately, although it can be very uncomfortable and unpleasant, it's not a life-threatening condition. And also equally important, it's not an indication of more serious illness. And the third thing is that as we learn more about this condition, I think we all understand that it's not a single disorder. It has a common symptom complex, but the causes are likely different from individual to individual. Now let's talk a little bit about the factors that affect the irritable bowel syndrome. And this is one of the most important talking points, this concept of the brain-gut connection. We know in many patients that there are hypersensitivities within the gut, and we know from research that there are alterations in the nerve muscle signaling. But we also know that these abnormalities are talking to the brain, and in turn, the brain is talking back to the gut. So we know, for example, that if a patient has an infection in the gut, that can trigger altered bowel symptoms, and they can then in turn signal those sensations to the brain, and they can be modulated by what's going on in our life, which in turn can signal back to the gut and make the gut even more sensitive and actually worsen our symptoms. Now, there are a number of exciting advances in terms of the understanding of the irritable bowel syndrome. On the left of your slide, it shows some of the concepts that we've known about in the last couple of decades. And there's also this emerging information that there's a low level of inflammation in some patients in the gut, even though when we look inside with our colonoscope, the lining looks completely normal. Even when we take biopsies and look at routine testing with the biopsies, the pathologist will tell us that they're normal. But if you do specialized testing, there are some subtle abnormalities showing that something is subtly different in the gut. And now, on the right side, there are now some exciting emerging concepts about differences that may pertain to subsets of individual patients. And I'd like to spend just a few minutes talking about those in more detail. In particular, I'd like to talk about bacteria and food hypersensitivity. So what is this notion that the bugs or bacteria may somehow be abnormal in the irritable bowel syndrome? Well, to give you an appreciation of how our understanding has evolved, I've shown here on the left a culture dish, and many of you may remember from high school or university the ability to take an inoculum of bacteria and plate them out on a dish and grow up the bacteria. And that really was where our understanding of the bacteria in the gut came from. But now we have this explosion of new technology with molecular techniques, and we're able to tell in much greater detail which bacteria are there and what exactly they're doing. And you'll notice at the bottom that I've highlighted the fact that 80% of the bacteria that are in our gut we couldn't culture. So those old techniques, we didn't even know that they're there. So this has opened up a whole new area of exciting interest. And with that come a whole new vocabulary. Let me talk just a little bit about some of these terms because you may have seen them. So the microbiome, and this is the term that refers to all the gut bacteria, but it also encompasses their genes and their environmental interactions. In other words, the bacteria and their behavior. A related term is the microbiota, and these are the bacteria species that are present. And over 500 now have been identified. These are some very interesting statistics that impress me every time I read them. 90% of the cells in our body are microbial, and there are 100 times more bacterial genes in our body than human genes. And we have co-evolved with these bacteria. And we're now learning that they're an integral working part of us. So you can see that there's a tremendous dynamic going on in our body with these bacteria. So this is the old world. We knew about a few bacteria, and now we know that there are many, many more bacteria in our intestines. And the question is, what are these bacteria doing? One of the best examples of how this may be related to irritable bowel syndrome is the condition called post-infectious irritable bowel syndrome. And many of you, of course, will know about the tragedy at Walkerton where the water source was infected in the town. And almost 30% of the patients, or the individuals rather, in that whole town experienced symptoms of irritable bowel syndrome after that infection. So this is after the infection had cleared from the body, it left them with the symptoms of irritable bowel syndrome. And we know that these infections can upset the microbiome in the bowel. But now there's a lot of interest beyond that even patients who have irritable bowel syndrome but it didn't start with infection, that there may be subtle differences in their microbiome, and that may be playing a role in their expression of the irritable bowel syndrome. So there are a lot of very interesting questions being asked. So which of these bacteria are talking to each other? What are they saying to each other? What products are they making? And ultimately, we need to know how important is this and in which patients is it going to be important in. So this is a very exciting area and one that we're going to learn a lot more about in the coming few years. The other area that's very interesting and one that there's a great deal of emerging knowledge is this issue of food hypersensitivity. And I want to emphasize that this doesn't pertain to everybody because many patients experience symptoms with the act of eating, but if you have a hypersensitive gut, then any stimulus to the gut may well invoke your symptoms. But there are likely a subset of patients where what we're eating is playing a role in the expression of their symptoms. And one of the big areas is this notion of gluten sensitivity. And, of course, we've known about the irritable bowel syndrome, and we've known about the separate entity, celiac disease. But there have been a group of patients who have been coming to their physicians now for a number of years saying, when I go on a gluten-free diet or a gluten-reduced diet, my symptoms are much reduced. But when the doctors test them for celiac disease, they find that they don't meet the criteria for celiac disease in terms of the blood tests or the biopsies in the bowel. So no one really knew exactly what this entity is, but it was clear that many patients were feeling better. This is the only study that I'm going to show you the results of, but it's very impressive and provocative. And this study was carried out in Australia, and they took a large group of patients who gave that history of feeling better when they went on a gluten-free diet. Their IBS symptoms were much improved. And so they took those patients and they randomized them into two groups. They put both groups on a gluten-free diet. But with their permission and not knowing which group they were in, they spiked one of the diets with gluten. And you can see the results as shown on this graph. So this graph shows the expression of their symptoms on the y-axis, and the x-axis shows the number of weeks. The blue line are the ones who were on the gluten-free diet and got the placebo. The red line are the ones who had their diet spiked with gluten. And you can see that within a few days they had all their symptoms back again. So these people have sensitivity to gluten, and no one really understands yet what the mechanism is, but there's a lot of interest in trying to understand this. So these patients don't have celiac disease, but they're sensitive to gluten in the diet. So let's move on now and talk about the tests you may need. And the most important point that I want to make here is that IBS is not a diagnosis of exclusion. We make a positive diagnosis of irritable bowel syndrome based on a constellation of symptoms, the absence of red flags that I'll talk about in a moment, and a few tests. So what are the symptoms? Well, they're those that we've already talked about and you've heard from Sue: abdominal pain related to bowel movements, pain associated with irregular bowel habits, either constipation, diarrhea, or an alternating pattern, and then these other symptoms of gas, bloating, or possibly mucus in the stools. So those are the typical constellation of symptoms. And then what are the red flags? Well, if you have a progressive clinical course, then maybe you need to have things reevaluated. In other words, if your symptoms have been stable for a significant period of time and suddenly there's a marked progression in your symptoms, maybe something new's crept into the equation. Irritable bowel syndrome typically doesn't wake people out of their sleep at night, and if it does, it needs a more careful examination. Rectal bleeding can be associated with irritable bowel syndrome, but is not a feature of the irritable bowel syndrome. In other words, if you have trouble with constipation, you might have bleeding from hemorrhoids from time to time. But this requires an examination to make sure that that's what it's due to and not something else. Anemia is not a feature of the irritable bowel syndrome, nor is weight loss. And if it onsets at an older age, it's quite possible that it's irritable bowel syndrome, but there should be greater vigilance in this setting. And then finally, if you have a family history of colon cancer, inflammatory bowel disease, or celiac disease, then you likely will require some additional testing. So what are those tests? Well, if you're a young person and you have very typical features, symptoms of the irritable bowel syndrome, and absence of red flags, then your doctors probably will not advise many tests at all. Maybe simply they'll check your blood to make sure that you're not anemic. If you have diarrhea-predominant symptoms, then they'll screen you for celiac disease, and that's typically done with a blood test. Similarly, if you have diarrhea-predominant symptoms, we want to make sure that you don't have a coexisting infection, so we'll check with stool cultures, bacteria, and parasites. And then in some cases, it may require an evaluation of your colon. And this is typically done if someone's near the age of 50 and we want to make sure that there isn't a coexisting colon cancer. And this is usually done by colonoscopy, or there's also the option of having a CAT scan colonography, which is a virtual colonoscopy. And if you have some perianal type bleeding, some blood on the tissue paper or the outside of the stools, maybe a simple sigmoidoscopy when we just look in the lower part of the bowel is adequate. So depending on the type of symptoms you're having and other factors that I've mentioned, these are the types of tests that doctors would typically carry out. And with these, assuming that things are normal, we can be very confident in the diagnosis of the irritable bowel syndrome. So let's talk a little bit about managing the irritable bowel syndrome, and I love this Herman cartoon because this is obviously not the way we want to manage the irritable bowel syndrome because, again, as Sue's pointed out, each patient is an individual and your management is going to vary. So how do we approach managing? Well, healthy living is obviously very important, and that's the essential starting point. But then we also want to talk about targeting the main symptoms. So let's talk a little bit about some general management principles, and then we'll talk about some more specifics. So these are a little bit of motherhood statements, but I think they're always worth reminding ourselves of. And importantly, we need to eat a healthy diet. And we live in a bit of a chaotic world, and at times we don't have time to eat properly. But if you suffer from the irritable bowel syndrome, it's something you're going to have to make a priority about, and particularly to avoid a lot of fast foods and pop, caffeine, alcohol, and fatty foods. Pay attention to your bowel habits. So if you're someone who's troubled with constipation, don't ignore the urge to have a bowel movement. And similarly, if you have the urge to have a bowel movement and you go to the washroom and you're unsuccessful in having a bowel movement, don't spend inordinate amount of time in the washroom because that just disrupts the normal regulation even further. Exercise is important. Get enough rest. It helps all of us, and particularly when you have a chronic symptom disorder, it helps us to cope with things better. We live in a stressful environment, and we can't avoid stress, but we certainly can take steps to try and minimize that. And finally, if your symptoms are really troublesome, sometimes keeping a diary can be very helpful. And Catherine's already mentioned that the Canadian Digestive Health Foundation has this very nice app called GI Bodyguard, which you can use to help you track your symptoms. So let's talk about some specifics now. Let's talk about constipation. This is the one area where a high-fiber diet can be helpful. And you can do this either through a natural means, and I've listed some of the more common ways of doing that, or through fiber supplements. But fiber is not a panacea for everyone, and it's certainly worth trying this, and many patients get improvement, but not everybody, so don't be discouraged if it doesn't happen. A couple of important caveats about fiber, apart from the notion that it doesn't work for everybody. It's important to recognize that not all fiber is the same. And some fibers are fermentable, and that means that the bacteria in our bowel break down the fiber, and the byproduct of that is to produce gas. And gas can cause uncomfortable symptoms through bloating and flatulence. So be aware of that, and sometimes we're recommending to patients, particularly if constipation is not a large issue, that you actually need to decrease your fiber intake. If you're going to increase your fiber intake, do it slowly. Give your body time to adapt. And then you should also increase your water consumption. If fiber alone is not managing your symptoms, then it's probably time to talk to a healthcare provider about some additional treatments. And you can do this through a variety of stimulant and non-stimulant laxatives. And I'm sure that your doctors and healthcare providers would be happy to talk to you about this. And there's actually some new agents on the market that have been very well studied and seem to have added efficacy if they're needed. And finally, there are some patients whose constipation is related to an inability to relax the anal sphincter muscles. And so paradoxically, when we strain to have a bowel movement, we're actually contracting the muscles. And sometimes these patients will experience the sensation of having to repeatedly go back to the washroom to the urge to have a bowel movement, but are unable to pass anything and have to strain and strain. And for these individuals, biofeedback may be helpful. So that's another option and something to talk about with your doctor. Now, diarrhea is, of course, a very common symptom as well, and there are a number of things to discuss here. And this is where diet in particular might be important. Now, we've known about milk products, of course, and lactose intolerance for a long time, and also that artificial sweeteners, because they get broken down by bacteria, can cause diarrhea. But we're also learning that there are a number of other carbohydrates or sugars that are poorly absorbed. And sometimes cutting back on these sugars can help with the symptoms of diarrhea. And then finally, I've already talked to you in a little more detail about gluten sensitivity and some patients feeling better when they reduce the gluten in their diet. Now, apart from diet, again, there are agents that are effective, and Imodium is an agent that you can buy over the counter, which will help with your diarrhea. And many doctors, and I've certainly had a lot of success with using low-dose tricyclic antidepressants at nighttime. Now, we're not giving these as an antidepressant, but we're giving them because they suppress reflexes in the gut, and it diminishes the urge to have a bowel movement. And it also has a little bit of a constipating effect. So many patients find these agents very helpful. They have a bit of a sedative effect, too, so you tend to sleep better at night. There's some evidence for probiotics, although there's a lot to learn yet in this area. And then finally, we're learning that bile acid binding agents may be helpful in a small group of individuals as well, because they may be spilling some of their bile acids into the colon rather than having them reabsorbed in the small intestine, which normally occurs. Let me just talk a little bit about probiotics, because you read a lot about that in the literature, and there are a lot of agents on the market. The main point I want to make is that there is some evidence for efficacy, but it's fairly limited in its potency in terms of the degree of benefit that you're going to get from them. And I think that there's a lot yet we need to learn about this. We still don't really know what the right mixture is. We don't really know how they work. And we don't know how the best way is to get these organisms into the intestine without them being killed, for example, by the acid in our stomach. And then finally, we don't still know who's likely to benefit. The good thing about probiotics is they're safe to take. And then finally, in terms of management, what about abdominal pain? Well, here's where low-dose tricyclic antidepressants can be particularly effective, or your doctor may use full-dose SSRIs, such as Paxil. But again, not because they're being used as an antidepressant, but because they'll suppress gut symptoms. Some patients have had a great deal of success with hypnotherapy in terms of managing their symptoms, others with acupuncture, and cognitive behavioral therapy has been shown to be very effective for some patients. And then finally, there are some antispasmodic medications that you can talk to your doctors about. These have not been particularly well studied, and it's really a trial and error. Some patients will respond and others unfortunately don't. So let's just end up by talking about living positively with irritable bowel syndrome. And it's very important that your healthcare provider understands your concerns. You need to communicate with them in a way that they understand why you're coming to see them, because sometimes their agenda and your agenda may not be the same, and I'm sure that's very frustrating for patients and doesn't attend to your concerns. Secondly, you need to set realistic goals for yourself. Unfortunately, we don't have a cure for the irritable bowel syndrome right now, but as I've mentioned, there are a number of different ways that we can try and minimize the symptoms so that you can get on with enjoying your life. You need to work with your healthcare provider and take responsibility for healthy living. And by that I mean you need to pay attention to your diet if you have a hypersensitive gut, and also these other factors such as exercise, sleep, and stress reduction. Some patients who have irritable bowel syndrome find that anxiety and decreased mood can be a trigger for worsening their symptoms. This isn't to say that this is the cause of your irritable bowel syndrome, but like many conditions, heart disease, arthritis, they can negatively affect the expression of your symptoms. So it's worth talking to your healthcare providers if you're experiencing these symptoms, because apart from addressing those which in their own right are troubling, it can also benefit your symptoms of the irritable bowel syndrome. And then finally, I outlined for you a number of different medications that can be considered. We like, if you're going to go on medications, suggest that you do it for short periods of time and see whether they can get you back to a level where you're enjoying life again. So I'll end there and turn things back to Catherine. Thank you very much for your attention.
That's a wonderful presentation. Thank you so much, Dr. Vanner. We've got lots of questions, so we'll just start going through them. The first one that I think is important is we'll ask Sue to chime in on this again, is that a question asking, what is that morning routine that you were talking about? Because you stressed it a couple of times in your talk and said how important that is and that you never waver from it. So can you share with us what that morning routine actually is?
Well, I always get up at least 45 minutes to an hour before I have to leave the house, and sometimes that means very early mornings for me because I like to do a lot of stuff. I usually have 1 cup of coffee, and oatmeal is the other thing that I have. And I just get moving around the house for about that 45 minutes and an hour, and that seems to work for me.
Okay, great. Another question for Dr. Vanner is, what does it mean to have a normal bowel movement? What is normal?
Well, there is no normal, I think, is the short answer to that question. There's a wide range of bowel pattern in society. Some people go 3 times a day. Some people go 3 times a week. What's important is that you're not having uncomfortable symptoms associated with your bowel movements. So I think the bottom line is that we should be striving for comfort rather than a set number of bowel movements one day or the next.
Okay, great. Another question is, will a bowel cleanse help me?
Well, the answer to that is no, and unfortunately there are a number of proponents who are trying to suggest otherwise to us. But the only indication for a bowel cleansing is someone who has very profound constipation, and we want to start a laxative agent, and in some cases we'll give them a bowel prep to clean out their colon so we can start sort of afresh with this agent then to keep them going on a regular basis. But it's important to remember that the whole role of the colon is to store the non-absorbed materials in our body till it's convenient to expel them. And so it's very healthy and that's the whole role of the colon, to retain stool.
Okay, and I'll just add to that Dr. Vanner was actually the specialist on the CBC Marketplace investigation on whether or not bowel cleanses were beneficial or not. So if you're looking for the link to that, I can actually get it to you if you just shoot me an email at director@cdhf.ca. I'll make sure that you can take a look at that. We have a few people who are asking if you can elaborate more on what biofeedback is, actually define it a little bit more clearly and help them understand how they can use that.
Biofeedback is a technique where you actually have a visual readout, or you can see what your muscles are actually doing. So in the case of biofeedback for constipation, what happens is that an electrical a tube with allowing electrical readings is placed just in the anal canal, and it picks up the electrical recordings of the muscles. So when you voluntarily squeeze the muscles, you can see the signal on the computer screen, and then when you relax, you can see the relaxation. So that gives you an immediate visual feedback of what the muscles are doing. And then the technicians will take you through a series of exercises so that when you strain to have a bowel movement, that you ensure that the electrical signal is decreasing and not increasing. Because in some cases, and this isn't the majority of people with constipation, but in a subset of patients, what's happening is that when you strain to have a bowel movement, you're actually contracting the muscles rather than relaxing them, and hence the stool can't leave through the anal canal.
Okay. Another couple of questions that are related, so I'm going to try and put them together, but they're about chronic constipation. And both of these individuals say that they eat lots of fiber from fruits and vegetables, whole grains, and they drink a lot of water, up to 10 glasses a day, and yet they're still having very hard stools that are really difficult to pass. So they're wondering, is there something wrong with their body that they're eliminating all of that water, or is there something that they can do to help retain the water and fight that chronic constipation?
Well, there are additional treatments. I think it's important to recognize that the colon in our body is one of the most poorly understood organs that we have, and so we don't really have a good understanding of constipation and what causes it. We do know that in some individuals, the nerve muscle connections in the gut are not optimum, and they need a boost. And so fiber is a booster. It distends the colon, and it activates those nerves and muscles that propel things along. But even that isn't enough in some individuals. And so you need an additional stimulant. And that's why I mentioned some of these various stimulant and osmotic laxatives that we have. So some people require additional stimulation above and beyond fiber in the diet. So I wouldn't be worried about that. It's a very common experience. Many people are adequately treated with fiber, but many people are not, and it requires some additional stimulation.
Okay. And there's actually a question that came in earlier today that I'm going to tag in here because I think it makes sense, because I think we're actually talking about the need to use over-the-counter remedies or perhaps prescription medication. And one of the comments that came in this afternoon was, I do not want to take prescription medications for my symptoms, which include constipation, but are there alternatives, and will they work as well?
Well, the answer to that is yes and no. I outlined, I think diet is very important, and we've talked about fiber already. And for those suffering from diarrhea-predominant irritable bowel syndrome, I mentioned several different strategies for modifying the diet. And I didn't mention, as I talked about, gluten reduction is one thing to try. The other is, and I'll give you the acronym, it's called a FODMAP diet, FODMAP, And that's a diet that enables you to reduce these carbohydrates. And some people find that their diarrhea and bloating is reduced when they go on these diets. So I think that's one area that you can explore. Now, I also want to caution you that you can find yourself on a very restricted diet if you're not careful. And so I certainly would not encourage you to get on a very restrictive diet. But you might try one of these two diets and see if your symptoms benefit. And, of course, make sure that you're not intolerant to milk products.
Okay, great. And you and I spoke about this a little bit earlier, so I'm just going to throw this out there as well, is that while you're deciding what your diet is going to be, you may want to consult with a registered dietitian or a nutritionist to make sure that you're getting the nutrients and everything that you need in the diet as you try to work through what's best for you, so that you're not eliminating all of the foods that your body actually needs to keep on moving well.
Yes, that's an excellent point, and I too would encourage people to seek out the help of a dietitian if you're going to try some of these diets.
Great. And while we're on diet, there's a couple of questions here that are related to fiber, and they're asking, what type of fiber do I actually want? Is soluble fiber one that's going to help me with managing my IBS symptoms?
Well, this is an important question, and a little bit of it is trial and error. But in general, there are two types of fibers. There's a soluble fiber and an insoluble fiber. And most of the gas that's produced in our body is produced by the bacteria in our gut. And fiber is one of the key foods for that. So the soluble fibers are the ones that the bacteria ferment, or they break down the fiber and they produce gas, whereas insoluble fibers, such as methylcellulose, are not as easily broken down by the bacteria and tend to produce less gas. So paying attention to the relative amounts of soluble and insoluble fiber may also be important in terms of reducing symptoms. And there's another area where I think talking to a dietitian and getting some specific advice around particular food products that are high and low in these agents is often very helpful for patients.
Okay. And while we're on diet, would you recommend that patients with IBS try a gluten-free diet or any of the other diets out there reducing lactose in their diet before actually being screened or biopsied?
Well, I think that it's not an unreasonable thing to do. A gluten-free diet is restrictive, and I'm not sure that you need to be 100% gluten-free, but certainly trying a gluten-reduced diet and see if your symptoms improved is not an unhealthy thing to do, and you may find that you significantly benefit from that. I think certainly looking at milk products and seeing whether there's any relationship to your symptoms, and if you're not certain, going on a lactose-free diet for a few weeks and see if you get symptom reduction is also a reasonable thing to do.
Okay. And in that same area, are there other diagnostic tests out there to test for food sensitivities?
At the present time, there isn't. We do, for lactose intolerance, there are breath tests. So you swallow a lactose capsule, and then we get you to breathe into a bag, and we collect the expired gases and measure them. We can tell whether the bacteria are breaking the sugars down or not. But beyond that, we don't have any tests for food sensitivity, apart, of course, from celiac disease. Okay.
Then switching veins a little bit, we have a comment that says, I've read in the past that sexual abuse is somehow related to IBS. Is there any science behind that?
Well, there is actually. We're learning more and more about this mind or brain-gut connection, and I think that's where the science lies. And we know that many patients with the irritable bowel syndrome, if you do specialized scanning of the brain, that their sensory signaling from the gut has been altered. And it's believed that traumatic events in our life can change how we integrate these signals to the brain, and then in turn how they signal back to the gut. So that's believed to be the mechanism behind this. Now, what the actual neurotransmitters are in the brain that are responsible, and we still don't know, and hence we don't have specific treatments for this. But we are beginning, through specialized imaging such as PET scanning, to gain an understanding of how these traumatic events in our life can play a role in the expression of irritable bowel syndrome.
Interesting. The next question says, I am currently taking mesalamine, which I believe is generally used for the treatment of IBD, inflammatory bowel disease, rather than IBS. But this person says that they're taking it and is asking if it's appropriate for IBS, and will taking this medication lead to other health issues in the future?
Well, it's a very interesting question, and if I've been asked this question a week ago, I would have said there's no data on this, but I was just at a meeting in the States last week, and a paper was presented using mesalamine in irritable bowel syndrome and showing some improvement in symptoms. Now, this is a single study, and I think it hasn't gone through scrutiny yet of the peer review system, but it's being looked at. And this study would suggest that there might be some benefit from it. The rationale behind this is that you may remember earlier on in my presentation, I mentioned that there are some subtle abnormalities in inflammatory molecules in the gut. And so mesalamine is an anti-inflammatory agent, and that's the rationale for trying it. So I think the jury's not out on it, but it's possibly something that could be of some benefit in a select number of patients. On the safety side of things, in general, these agents are very safe. They're on high doses of them. There has been reports of kidney disease, but that's very rare and usually with very high doses of it. And then, of course, with any medication, there can be a hypersensitivity response to the agent. But if you've been on it for a while now and haven't had that, then it's not going to occur.
And next is a comment that says, I suffered from a bacterial infection 5 months ago, but now continue to experience post-infectious IBS. What can I do? I take probiotics and I watch my food intake. Will this ever go away?
Well, there's good and bad news here. The general natural history of this is that it sort of waxes and wanes over time. And in general, it tends to get better. So that's the good news. Whether you'll go back to your previous bowel pattern before, there's a good chance you may not. But it generally tends over time to get better. And there are no specific treatments for this beyond you're trying probiotics, which I think in this setting is a wise thing to do. And then some of the other general measures could be tried if your symptoms are really problematic. For example, low-dose tricyclic antidepressants at nighttime, for example, or something that could be tried in this setting. You could also want to think about some of the dietary measures that I mentioned as well.
Okay. And we're getting close to the end of our time, so we'll just go for a couple of more questions. One of those is there a way for me to stop losing weight? I have trouble keeping weight on, especially when I'm having a hard time. So what's the most common way that what are the most common things that I can do to try and keep weight on?
Well, this is a very important question, but is one that's really outside the realm of discussion around irritable bowel syndrome. So I think if you're having problems with maintaining your weight, then I think that you need to see a physician and have this reviewed. You want to make sure that you're taking in adequate calories, and if you are, then you want to make sure that you're not malabsorbing those calories. So I think this is something that really needs to be reviewed by a physician and if need be, have some additional tests done or see a dietitian.
Okay, perfect. And second last is sometimes the pain is so severe that I end up in the emergency department. What can I do to try and stop that pain or management so that I don't actually end up in the hospital?
Well, unfortunately, this is an individual who has quite severe irritable bowel syndrome, and I guess the first thing is we want to make sure that the diagnosis is correct, and I assume that this has been adequately addressed by their physicians. But assuming so, then we need to work with some of these management strategies that I talked about. And if you haven't tried low-dose tricyclic antidepressants or an SSRI, I would certainly be encouraging you to do that. Some of the other measures, such as the dietary interventions, I certainly would suggest that you pursue as well as the general measures that we talked about. So those are the kinds of things that I would be looking at. If those are still not working, then some of the other measures I think would be worth trying as well, such as considering hypnotherapy or possibly cognitive behavioral therapy.
Okay, great. And the final question, you went over it in your presentation, but I think it's worth mentioning again because I know at the Foundation we get loads of questions from people who are suffering from IBS, and they're really quite fearful that there is something seriously and possibly fatally wrong with them. So the question is, how can I truly know that there really isn't something seriously wrong with me that's threatening my life?
Well, this is a very important question, and it's a great one, I think, to end on. I talked about how we make the diagnosis of irritable bowel syndrome, and it's not just the symptoms, but in my experience, if there's been a misdiagnosis of irritable bowel syndrome, these red flags are evident. So if there's an absence of red flags and have the typical symptoms and your doctors have done a few tests, then it's important, I think, to reemphasize that we can make this diagnosis with a great deal of confidence. And we've actually looked at this in a prospective fashion over years to make sure that the diagnosis doesn't change in patients, and indeed it doesn't. So we can make this diagnosis with confidence, assuming that it's approached in the right fashion.
Okay, wonderful. Those are great assurances to have. So that is the end of our time, and I wanted to, on behalf of the Canadian Digestive Health Foundation, thank Sue Grant for sharing her experiences with us, Dr. Vanner, you for sharing your insights and your expertise, the Canadian Institutes for Health Research for partnering with us, and extend our very special thanks to you, our audience, for joining us. We hope this session has provided you with a better understanding of irritable bowel syndrome, IBS, and empowered you to live positively with this disorder. Please remember to visit cdhf.ca. Thank you again, and this concludes our session.